The choking stopped. That is not the same as the popcorn leaving. A child coughs hard for 20 seconds. Then it settles. Color comes back, breathing is fine, and everyone goes back to the movie. That is genuinely the most common ending, and it is the right thing to hope for. Sometimes the coughing stops for the other reason. A fragment reached a place the body cannot cough it out of. The reflex gives up. The child looks completely normal. And nothing about that moment tells you which one happened. Write down the date, send this to whoever was there. Doctors worry about popcorn more than a plastic bead the same size. Which sounds backwards. A bead is a toy. Popcorn is food. Food is supposed to be the safe category. That is a reasonable way to sort the world. The airway does not sort things that way. A plastic bead sits there. Popcorn does not sit. It is oily and organic, so the airway reacts to it chemically, not just physically. Swelling, mucus, and the piece softens and breaks apart. That reaction is why weeks later still matters. Share this. Airway foreign bodies have 3 phases. Most families only see the first. Phase 1 is the choking. Loud, frightening, impossible to miss. It ends, and it feels like the whole event ended with it. Phase 2 is the quiet one. Days or weeks where almost nothing happens. This is where the event gets forgotten. Phase 3 is when the cough comes back, or the wheeze, or the infection, and nobody connects it to a snack from last month. Send this to a parent in Phase 2. A child was treated for asthma for months. It was never asthma. Wheezing, cough that got worse at night, a partial response to an inhaler. That is a textbook picture, and treating it as asthma was the correct first move with the information available. One detail did not fit. The wheeze was on one side. Asthma is usually both. Bronchoscopy found a popcorn fragment. The inhaler had been treating the swelling around it, which is why it half worked. If the wheeze is one-sided, say the word choking. Share this. Pneumonia 3 times in 1 year is not bad luck. Small children get a lot of infections. Daycare, siblings, winter. 2 or 3 in a season does not usually mean anything is wrong. Most of the time, that is exactly right. Unless it keeps landing in the same place. Infection that returns to one spot is asking a different question than infection that moves around. Something may be sitting there, blocking drainage, giving bacteria the same address every time. Ask if it was the same lung. Send this. A normal chest x-ray does not rule out popcorn. X-ray is the obvious step. Something went into the chest, take a picture of the chest. For a coin or a pin, that settles it. It is the right instinct. Organic material does not show up. Popcorn is not dense enough to cast a shadow. What a radiologist may see instead is indirect. One side of the lung not emptying the way the other side does. You have to know to look for it. So give the history out loud. It changes what they look for. Share this. The American Academy of Pediatrics says no popcorn under 4. Most people have never heard that. It is soft, it is light, it dissolves in your mouth. It reads as one of the safe snacks, and it gets handed to toddlers at every birthday party. Under 4, the molars are not in yet. Grapes you can quarter. Hot dogs you can slice. There is no way to cut popcorn into a safe shape. That is what makes it different from every other item on the list. 4. Not 3.5. Send this before the next party. There is one sentence that changes what doctors look for. When a cough will not go away, you describe the cough. How long? How bad? Worse at night. That is what you are asked for, so that is what you give. Lead with the choking instead. About 6 weeks ago, she choked on popcorn. That sentence moves a hidden foreign body onto the list. Without it, the cough is just a cough, and the workup goes somewhere else. Save this sentence. Send it. The choking stopped. The popcorn may not have left. It hides from x-rays. It can imitate asthma. It can send the same lung to the hospital 3 times. And it can do all of that from a snack nobody remembers. Which is why the easy version is the age. Under 4, skip it. After a choking episode, write the date down. If a cough outlasts a month, say what happened. Somebody is handing a toddler a bowl of this tonight. Send them this.